Myself, Dr. Prashant Kumar Parida, medical oncologist. So there was a doubt, what are the conditions or situations in a cancer patient when chemotherapy and radiotherapy should be given together or concurrently. So there are few malignancies, for example, head and neck cancer, esophageal cancer or esophagogastric junction cancer, rectal cancer, pancreatobiliary cancer, rarely in bladder cancer, where we sometimes provide chemotherapy along with radiotherapy, and where chemotherapy act as a radiosensitizer. That means the sensitivity to radiation of a cancer cell increases by providing or giving chemotherapy. In addition to a radiosensitizer, chemotherapy acts as a systemic therapy. So what is the role of systemic therapy here? Systemic therapy will take care of the micrometastasis. For example, in breast cancer or in head and neck cancer, sometimes what happens, after completion of surgery and all modalities of primary therapy, the recurrence occurs distantly. That means distant recurrence. So by giving chemotherapy in addition to radiosensitizer, it also prevents the distant recurrences or distant metastasis. So that is the role of systemic chemotherapy when we are giving in addition to radiotherapy. So what are the conditions or what are the malignancies? Usually in head and neck. In head and neck cancer, either a adjuvant chemoradiation, adjuvant means after surgery or after removal of the tumor tissue, we usually give radiotherapy as a local form of therapy. In addition to that, in few situations, for example, if margin is positive or extranodal extension is there or other high risk factor like N2, N3 disease is there, so we usually give systemic chemotherapy in addition to radiotherapy. It is called as concurrent chemoradiation. So by giving concurrent chemoradiation, chance of recurrence decreases in future. Similarly, sometimes those malignancies in head and neck cancer are inoperable or bulky disease. In that case, we usually treat them as curative intent chemoradiation. So in addition to radiation, we can give chemotherapy in a curative dose of radiation. So it also acts as a radiosensitizer there. Other malignancies are like esophagus. Esophagus is a thoracic organ. So sometimes we give chemoradiation, especially in upper esophagus squamous cell carcinoma, concurrent chemoradiation in a curative intent, and in lower esophagus or G junction, sometimes after surgery as a adjuvant chemoradiation. Also in rectal malignancies, especially clinically T3 or more than T2 lesion or in node positive disease or locally advanced rectal cancer, the concurrent chemoradiation we use in a neoadjuvant setting, means before surgery. By giving neoadjuvant chemotherapy, usually give chemotherapy like oral capecitabine in addition to the curative dose RT, either long course or short course RT. And in rectal malignancies, in addition to the systemic control, the addition of chemotherapy to radiotherapy increases the pathological complete response. That means the response rate increases, and pathological complete response means after surgery there will be no residual malignancies in the specimen. So this is called as pathological complete response, and pathological complete response has been associated with better long-term outcome. That means the survival will be better those who will achieve pathological complete response. Similarly, in pancreatobiliary malignancies, especially after surgery, in addition to radiotherapy, we usually use 5-FU or oral capecitabine as concurrent chemoradiation therapy. And other malignancies like bladder cancer, where though previously we are using the chemoradiation, but nowadays we rarely use chemoradiation in bladder cancer. Similarly, anal cancer or anal malignancies, usually squamous cell carcinoma, we treat them radiation along with 5 days systemic chemotherapy regimen, and that is MMC 5-FU, mitomycin 5-FU for 5 days. And these are the malignancies where we usually treat, give chemotherapy along with radiotherapy, and it has been seen that concurrent chemoradiation increases the response rate, and sometimes in pathological complete response, which has been associated with better long-term outcome. Thank you.